What's your last name?
Bright.
David Bright.
Yep.
All right. I'm Oliver Jones here with David Bright from Excel Sports Rehab, and I'm going to ask him a few questions. He's a physical therapist here. First of all, can you basically give me a description of your job as a healthcare provider?
Absolutely. I'm an outpatient orthopedic physical therapist. So my role is when someone has pain, they may have surgery. In this case, we're talking about ACL injuries. So after they've had an ACL injury or ACL surgical repair, they're going to come see me, and we're going to do physical therapy with them, which is going to consist of restoring their mobility, such as their range of motion in their joint, and getting their strength back and getting their function back so they can return back to their prior activity levels without limitations.
Yes, sir, definitely. The description of your services, like what does a physical therapist do on a day-to-day basis?
What we're going to do is we're going to have people come in the clinic. For the first time a person would come in, we're going to do an evaluation of that person. So we're going to look at them and see what their specific limitations are, such as, is this person able to get their knee straight? How far can they bend their knee up? How much strength do they have in that muscle? We're going to be able to assess those specific things so that we can figure out where their limitations are. And we're going to look at what their goals are and what they're trying to get back to doing. So if we have a high-level athlete, we know we've got to really get them back a lot further than if we have somebody that's just looking to get back to walking and not falling down or something along those lines. Right now, the world of physical therapy, most physical therapy degrees are doctorate-level degrees. So you're going to graduate from Clemson, you're going to graduate before you go to, and then you're going to go to a physical therapy program for the next 3 years. And a lot of those programs will go year-round. So it's not just going to be fall and spring, but you may go fall, spring, and summer for the next 3 years and come out with a doctorate degree in physical therapy.
Definitely. As a healthcare organization, overall, where does physical therapy fit into the organization?
So with physicians, we see a lot of referrals from family physicians, from orthopedic surgeons or orthopedic docs that are going to send patients to physical therapy. In the state of South Carolina, a physical therapist is able to see patients in the clinic without a referral from a doctor as long as we don't see them for longer than 30 days without some type of correspondence with the physician. So we are autonomous in a sense that we can see individuals without that relationship with the referring physician, but we are a piece of the puzzle in the healthcare system in a sense that we can help to alleviate pain and alleviate problems for individuals that get sent to us or that just come to us to seek out our services.
Definitely. What are some of the issues that you face every day as being a physical therapist with completing your services?
Restrictions or limitations?
Restrictions or limitations from maybe insurance or from the customers.
Sure.
Something that prevents you.
Cost, as far as our country as a whole goes, cost is the biggest problem with healthcare right now. And everybody feels like they've got an answer to it. And you look at our current president, whose goal is to have healthcare coverage for everyone. I think that's a great goal. More importantly, to have affordable healthcare, I feel like we have to really rein in some of these lawsuits against health professionals that are just kind of ridiculous. It's kind of unfortunate in the United States now that you can't fall down somewhere without somebody being worried about being sued. You can trip over your own feet in a parking lot and you try to sue the owner of the parking lot for some reason. They had a crack in the parking lot. But you go out there and walk in the park and fall down, who are you going to sue at that point? So it's unfortunate that everybody wants to sue somebody when something bad goes down. And it used to be the lawsuits was just whenever something malice or terrible, the doctor did something way off the beaten path. But now, if you go to the doctor and you have a bad outcome, people want to sue the doctor. Well, those lawsuits create high insurance premiums for all these doctors. Well, the high insurance premiums mean that they've got to get more patients in just to pay their insurance. And the only people making money is the lawyers that are turning around suing everybody. There's no penalty for suing 10 people, but unfortunately there's a big penalty for the person that gets sued because they have to pay for all of that. So my thought is, I really feel like we got to address these ridiculous lawsuits. Tort reform is something we need to look at as a country, but trying to get a group of attorneys that are now senators, taken away from their attorney friends, that may be our challenge as a country. But that's my opinion.
That's about all